Never fails. Okay. Okay, I think we should be good and live now. So good morning. I have Dr. Martin here with us, our Young County Health Authority. And after a really crazy year of going through a pandemic, Dr. Martin's here with us to give us an update on what's going on now. So before we kind of dive into questions, I want to say thank you to Y100.5 for sharing this feed on their broadcast and helping us to get the word out. And of course, thank you so much for being here with us, Dr. Martin.
Oh, thank you for having me.
Absolutely. So also for those of you watching on Facebook Live, if you want to send questions via the comments, we'll try to get to some of those as we chat. Or if you have questions afterwards, you can still leave a comment or shoot me a message. I'm certainly not a healthcare professional and won't claim to be, but if it's something maybe we could cover in a future chamber chat, we'll try to do that. So let's start, I guess, Dr. Martin, by talking about the Delta variant that is now, I guess, starting to spread in our area and in most areas. Can you give us an update on that and maybe explain that a little bit?
What we're seeing right now is 85% of the cases in the state of Texas are Delta variant. We're definitely having that here in Young County. We've had a large increase in numbers over the past 3 weeks of both sick people as well as hospitalized patients. The Delta variant is affecting people who are not immunized. We've had very, very few cases of people who've had vaccines that are getting Delta or any COVID at all. So that's what we're seeing. And we've had, I think, 12 people in the hospital now in the last week. We've had one death in the emergency room, unfortunately. And we have currently 5 people in the hospital with COVID related illnesses. So we've definitely seen a surge. That was after several months of not having any.
I think we all kind of felt like we were past it, like it was over. And now we're realizing, no, it's not over. And maybe won't be for a really long time. So can you tell us a little bit about the differences of the Delta variant versus what we experienced with that original COVID pandemic? Like what are some of those differences on maybe symptoms or who is being, who's actually getting it demographic wise and things like that?
The symptoms of the Delta variant are exactly the same. The difference with the Delta variant is it spreads much easier. So the initial COVID, it was a little bit hard to catch. You had to be with somebody a significant amount of time and you had to be pretty close to someone. They're telling us that the Delta variant can spread a lot easier, similar to how chickenpox can spread. It can kind of spread across a room if you're just talking to someone, or if you're just in a room with someone. So I think that's why it's spreading so quickly. Demographic wise, it's more young people that we're seeing right now, like 45 to 60 are the average patients that are in the hospital. That's multifactorial. Part of that is the Delta variant may be affecting younger people more, but also the older people have been more aggressive at getting vaccinated. So seeing a little bit of both, but the people that we've had in the hospital have been almost all between the age of 45 and 60, which is drastically different than what we had.
That's interesting too, because I guess like you said, there's a lot of factors there, and it's hard to say whether that's because this is a group of our population that did not receive the vaccine, or is it truly age related, right? Is that hard? I'm sure that's hard to figure out.
I don't think it's so much age related as it is a factor of who's had the vaccine and who hasn't. And I think a lot of people below the age of 60, kind of have been reluctant to get the vaccine.
So let's talk about that a little bit, because I certainly have heard a lot of people express reservation on getting the vaccine, and I've heard a lot of people talk about how effective it is and how important it is. So can you share a little bit, what are you seeing as far as effectiveness of the vaccine and side effects of the vaccine?
The vaccine is extremely effective. We've just, I think the last numbers we checked, we'd had 90 new cases, and 87 of them had 87 of the new cases of COVID had not been vaccinated. There are always going to be occasionally people that have a failure to the vaccine. They may be on chemotherapy, or they may be taking steroids, or they may have some other something that's suppressing their immune response. And so when those people get a vaccine, it may not take on them, but those are very few people. And most people who've had the vaccine have not caught COVID. The ones that have caught COVID here in Young County, we haven't had anyone who's been hospitalized with a COVID related reason who has been vaccinated, not a single one. As far as side effects from the vaccine, this vaccine makes your arm really sore. And for about 24 hours, your arm's sore. And a lot of people get some low grade fever with the vaccine, chills, maybe a low grade fever, achiness. That's common with all vaccines, but it is a little bit more significant with COVID. And anyone who's had both doses of the COVID vaccine, most of those people have experienced a little bit of that.
I have experienced a little bit of that, but I also told people that, that 24 hours, I felt pretty crummy. It was nothing compared to the 8 days with fever when I had COVID. So I can take the 24 hours.
That's like, hey, I'll suffer for 24 hours to not have people going through with COVID.
Absolutely.
And as far as, more serious side effects of the vaccine, they're extremely rare, but they get all over the news when there is a bad outcome or something with the vaccine. It's blasted all over the news, but they're really been extremely rare. As far as serious outcomes from vaccines, they're like 0.000005% of vaccines can cause a serious reaction. In Young County, we've had 0 serious reaction. We've had nobody in the hospital with a vaccine related, problem, not a single. And so you flip that around, and your chances of having a serious reaction, having COVID, are about 30 to 40%. That's not death. People like to say, oh, only 1% of people are dying from COVID. But what we've been seeing the last few months, when we weren't seeing acute COVID patients, we're seeing the effects, the after effects of COVID that it has on people. And a lot of people really have some serious problems after COVID, trouble breathing, just getting winded doing basic things. Some of them have cardiomyopathy, which is just their heart's kind of floppy after having that virus. Others have neurologic problems afterwards, neuropathy, pain, tingling in their feet. Depression has been really common after COVID. Breathing problems, of course, the people that have the really serious pneumonia, some of them develop fibrosis of their lungs, which makes their lungs really tight and hard for them to get a breath. And those are things that may not go away. So, vaccine, early on, we didn't have a way to prevent that, but now we do. And a vaccine will prevent this in more than 99% of the people. It's
so
good.
This is something I kind of mentioned this to you, and I had a conversation recently, and it just kind of piqued my interest a little bit. But, I've been kind of fascinated really with looking up, the way that we were able to essentially eradicate smallpox and pretty much polio also. And kind of looking at like the vaccine for that and how it was administered and how we really did eradicate it. So can you kind of give me a quick just comparison to, let's just say polio versus COVID and the vaccine and all of that?
Yeah, I think those are great things to look at. If take smallpox, it's basically off the face of the earth, except in laboratories at this point. And you just imagine if people had been reluctant to get that vaccine, if only half the people had got the vaccine, we would still be dealing with that throughout the world right now. And so with COVID right now, the COVID strains, and there's multiple new strains with COVID. There's an alpha, beta, gamma, delta, epsilon that I know about. There may be more than that. And it's just a matter of time before that mutates to a point that may be more resistant. But if you could magically get the whole world to get the vaccine right now, we would end that. It would just be gone. We would not be bothered by COVID again, because right now, all the strains, including the Delta strain, are the vaccine's effective at preventing those.
And, it's kind of crazy or not crazy, but I guess interesting to look backwards and think about when people took that polio vaccine, which from what I understand was far less effective and far more dangerous than the COVID vaccine. But that, them doing that literally prevented future generations, us, from ever having to deal with, polio and smallpox. And, I think that maybe our future generations, our grandkids one day will be very thankful to us for helping to eradicate COVID, if that's even a possibility at this point. But
I think you're right. I think that, 20 years from now, people may look back and either be saying, gosh, thank goodness they did that, or wow, I wish they would have done that. I wish more people would have got the vaccine so we're not still battling this, every year with a new strain, which may be what we're going to be dealing with.
And I've heard a lot of people, and I think it's well intentioned, but still a little bit heartbreaking when you really think about it. But a lot of people that say, well, it's really only affecting the elderly, which is so sad to say. I mean, when you think about what that is implying and what that says, that's a really, really sad thing to say, or even think or feel. But really, either way, in a few short years, the elderly will be us, and so that will be us who are more susceptible to that virus.
Yeah, I think you're right, and I think that also we are seeing with this Delta variant, and what we don't know if this is because it's more aggressive or if it's just related to who's had the vaccine and who hasn't. But we're seeing a lot of people in the hospital that are between 45 and 60. We're not seeing people in the hospital that are older, probably because they're vaccinated. But the Delta variant does seem to be affecting these younger people. Also, I know Cook's Hospital has had more admissions, this time around than they did last time. So I know we are seeing it even in young children.
Wow.
So it's out there and it is affecting young people. They're not immune to it. Most young people still do really good with it, but there are more sick cases with this Delta variant than they did before.
Well, and I know from a medical perspective, prevention of death is probably the first priority. Or I guess prevention isn't really the right word, maybe postponement. But regardless, it's still not I've said this before in some of our chamber chats, it's not a pleasant experience to have COVID for multiple reasons. And even if, I consider myself fairly young and healthy, but I was sick, really sick with it, and trying to homeschool kids at the same time and try to work from home when I could. And so that's, that alone, I didn't have the worst case scenario by any means, but I don't want to do that again, ever, ever. So my kids might be a little traumatized over it.
You can imagine these 45 and 50-year-old people are very busy people with accidents, and they're in the hospital right now. They're going to be in the hospital for a week to 10 days, and then they're going to be out of commission for another, month. And that's really hard to do. I can't imagine being out of work for a month right now. Don't, pay all the bills you have to pay, all that has to get put on hold. So there are a lot of, kind of a lot of fears with the vaccine that I think we should maybe touch on that had questions about. Yesterday, actually, I had someone they were not getting the vaccine because their husband didn't want to get the vaccine. And they were afraid that if they got the vaccine, they would give COVID to their husband. And so I think it's important for people to know that none of the vaccines are live vaccines. None of them give you COVID, not even a touch of it. There's absolutely zero chance of you catching COVID from the vaccine. They're not even giving you the vaccine. They're not even giving you the virus when they give you the vaccine. They're giving you something that makes your body produce a protein, and that's all it is. And the second thing we've heard a lot about is people thinking that there's metal in the vaccine, and the vaccine might make, people even, on the computer holding spoons up where they got the vaccine saying it'll stick or magnetize or something like that. That's
I have not seen that.
Completely not.
That's great.
Vaccine. So there are some myths out there. I think if anyone has questions like that, we definitely like to answer those type of questions. And if people are not getting a vaccine because they're scared of something that's just completely not true, then we want to let them know about those things. So
What about Dr. Martin? This is, and I might be putting you on the spot a little bit with this one, because it might be just too soon to even know or be able to say with certainty. But one of the things that I've heard come up a lot are fertility issues, like long-term fertility issues. And is that something that you can speak on, or is it just too new that we really don't know yet?
There's absolutely no evidence that it causes any fertility problems. Lots of people have become pregnant already after having the vaccine. In the United States alone, 177 million people have had this vaccine. We haven't seen any decrease in fertility rates, no drop off in the number of people getting pregnant. So that's another one of those things. It's just a rumor. It's a completely baseless rumor. American College of Obstetrics and Gynecology strongly recommends that all women get the vaccine. They actually recommend that even when you're pregnant, you get the vaccine. So
Okay.
The American College of Obstetrics and Gynecology is probably the most conservative group I've ever seen. As far as when they come out with a recommendation, they're very certain the benefit of that outweighs any possible harm.
Risk. And I'm guessing that there's probably some risk associated with contracting the virus while you're pregnant or have a new, et cetera. So I'm sure there is another side to that, I guess, a flip side to that.
The COVID during pregnancies is extremely dangerous. And, I've seen adverse outcomes with that, and it's awful. So if you're pregnant, you definitely should get your vaccine. If you want to get pregnant, you should get your vaccine.
So I think there's a pretty clear message here, right?
There's really not a good reason not to get a vaccine unless you're one of the 0.00005% of the people that have had a serious reaction with the first vaccine. Then we would probably have you not get the second vaccine. That would be about the only legitimate reason. Not to say that I'm in favor of forcing anyone to get the vaccine. I want people to choose to get the vaccine, but getting the vaccine protects you. It also protects your friends and your family. In the community at large, it helps protect.
And I think that's really because obviously I'm not in favor of forcing anyone to do anything unless it's like my husband to do the dishes, which is also impossible. So, but I do think, still working on that one. But I like the positive encouragement. Like, let's look at data. Let's look at what this does for us long term. What this does for humanity long term, and then make a good decision. And I think if we can all be human and just be good people, then we'll make a good decision, hopefully.
Dude, and I think we've talked about a lot, throughout this pandemic about just kind of using some common sense. And, sometimes the mandates that come out for New York don't make common sense here. But, out of all the crazy stuff that's come, with masks, no masks, all of that stuff. I mean, the one thing that's really been consistent through this whole deal is that the vaccine is a miracle. It's really helping. The other thing I think we should touch on is people are afraid of how fast the vaccine came out. And what people need to know is, first of all, they were working on this vaccine from 2005 on, because it's the same virus that caused SARS and MERS. And so they began working on this type of a vaccine. So that's part of why they were able to make a vaccine quickly. And the way they tested it quickly were because of two reasons. One, because President Trump funded it. So they didn't have to wait between phase 1 trials and phase 2 trials to gather money, which usually takes years on vaccines. And then they didn't have to wait between phase 2 and phase 3. They could just go straight forward because the government guaranteed they would fund these vaccines whether they worked or not. And so that let them go through those phases quickly, but they went through every phase that every vaccine has ever gone through. And more people have received this vaccine now than almost any other vaccine. And so, we really have a lot of data now that shows that it's safe. The other thing that helped this vaccine get approved quickly is, normally, let's say you're doing a test for a meningitis vaccine, it takes years to have enough cases to prove that it worked. So if you give 1,000 people a meningitis shot and 1,000 people you don't give a meningitis shot, and you watch them for several years, you only have a few cases of meningitis, even in the ones that didn't get a shot. But with this vaccine, because COVID was so rampant, it's very easy to give. They gave 40 something thousand people in the test, it was very easy to compare the group that had the shot to the group that didn't have the shot and see a huge difference. So those are the reasons this vaccine was produced quicker maybe than other vaccines. It wasn't because they didn't do the research or they didn't test it properly.
That makes a ton of sense. And I also, I know that I've talked to you about this a little bit, but one of the things that seems to always come up in conversations about the vaccine, about masks, about anything related to the pandemic is that it has become so politicized, and that, it is what it is. But I like to remind people that your role as Young County Health Advisor is not a political role. And that, I trust you. I think our community trusts you. And from what I can tell, you're not going to Facebook, to get your medical research, or, watching, Fox and CNN to gather your, data and opinions. This is true, medicine. This is healthcare, and you are a doctor. And so I'm not saying we shouldn't question things. I'm not saying that's not good to use your head and use logic. But I do think that when we are sick, or when we need help, we go to the doctor because we trust the doctor to help us get better. And it's kind of heartbreaking sometimes to see people question so many, intelligent, well-meaning, educated professionals out there who work in healthcare, and they're saying this is the recommendation. And I think, while it's hard for me to even pretend like I could ever be a doctor, but I think if I ever was in that role, it would be a little disheartening, because this is a community that you've served for a long time in the healthcare field. I can tell everyone watching right now, without a doubt in my mind, 100%, Dr. Martin cares about people. He cares about patients. He cares about this town. And so, it does kind of break my heart sometimes when I see people say they don't believe this research, or they don't believe this information. I don't always believe everything I see on the internet or on the news even, but I do believe what I hear from Dr. Martin. So thank you for getting accurate info out there.
Welcome.
Okay, I'm going to check and see if we have any. Oh, Marla said, when I had cancer, I trusted my oncologist and team. It gave me so much peace, which is so true, right? That's what we go to our doctors because we're not educated in this, and we don't know, but our doctors do. Let's see if we have any questions.
I would talk to their doctor about it, and we're not going to be angry with them if they're with their decision, but give us a chance to tell you the true facts that we know, and make a good decision.
Absolutely. Yeah. And I think exactly, if you do have reservations or concerns, go to the doctor that you trust. If you don't trust your doctor, find a different one that you do trust, and talk to them so that you can talk that out and express your concerns, and, figure out what makes the most sense for you. Because I think it's important that we do trust our healthcare professionals. They are under oath to make sure they protect people and do no harm. And I think that that alone should give us peace, but also, especially with our doctors here who've been serving our community and keeping us healthy and safe, there's no reason not to trust them.
Agree.
Excellent. Well, I don't see any other questions, but I do want to thank, we had a pretty good attendance today watching live. So thank you all so much for watching, and thanks again to Y100.5. And of course, Dr. Martin, thank you so much for sharing your time with us this morning.
Thank you for having me.
Awesome. Well, we'll be in touch soon, I'm sure. Thank you.
Bye-bye.
Bye.